Right, I might get started today. We have quite a few presenters joining us today to chat about asset management in Tupaia. So I will be your host for today. My name is Georgia and I'm the Head of Impact and Partnerships at Beyond Essential Systems. Today on our agenda, we have a lot of exciting presenters here with us. So we're going to start off with Geoff, who's going to present an overview of Tupaia for asset management and how it's being used. We're also going to hear from Salele in Tonga. We'll have a case study from Whitney in Palau, and we'll also have Tulia from Fiji presenting today. So I think we're going to start off with Geoff. So Geoff is a Tupaia project manager here at BES. He has led the Tupaia asset management projects across the Pacific. And even under Geoff's leadership and experience with our Tupaia asset management, we have been using Tupaia for asset management internally at BES, which has been exciting as well to sort of use our own system. So I'm going to hand over to Geoff now to provide us an overview of Tupaia for asset management.
Yes, thanks, Georgia, and hi, everyone. Good to be with you. So yeah, I'll just provide a brief overview of how Tupaia is being used for asset management, some of its sort of features, and also a little bit of a case study from Samoa, who unfortunately weren't able to join us today, but they've been using it quite extensively in Samoa. So next slide, please. So what is Tupaia? It's a data management platform that allows you to collect data, aggregate and visualize it about practically anything. So it's used in about 12 Pacific countries and other countries around the world for reporting on things like hospital admissions, disease outbreaks, and vector surveillance. It's got a few components. So there's the two data collection tools down at the bottom there. MediTrack is the offline data collection tool that's accessible on your smartphone or tablet. So you can collect data through surveys in MediTrack. DataTrack is similar. It accesses the same surveys as MediTrack, but you need to use a browser for DataTrack. But there's also some additional functionality in DataTrack that's not in MediTrack, like tasking functionality. So data collected in either of those applications syncs into an admin panel where surveys have been created, users are managed, and visualizations are created. And then that data collected goes out into dashboards, reporting dashboards on the tupaia.org website. So it all sort of links together. Next slide, please. So what are the features of Tupaia for asset management? So one thing it can do, so assets get registered offline on your smartphone using an asset registration survey. That survey generates a unique asset ID and also a QR code on a label image, which you can then print out and stick to the asset. So all data collected about assets is available on an asset register in tupaia.org as new data syncs. So that register updates with new information as soon as it's collected and synced. And on your mobile, you're able to view an asset's profile page by scanning the QR code on the asset label. So that'll take you directly to the asset's profile page. This is an example of an asset register. So this is from Samoa, who've kindly let me use it. So this is just basically a list of all assets, a searchable list. So you can, all the fields up the top from facility, ward, Tupaia ID, asset category, manufacturer model, serial number, all that's collected in a survey and it comes through into the dashboards and on tupaia.org, and then you can filter that and you can also export that asset table. This is an example of a profile page. So this is also on tupaia.org. So each asset has this type of page where you've got a basic listing of information that has been collected about the asset, the type of asset, manufacturer, the status and condition, which can be updated as well. It's also got the asset label on that profile page, so you are able to access that as many times as you want and print it out as many times as you want. If you need to relabel the asset should be already labeled at the registration point, but you can print out a new label if you want. There's also just detailed information. Anything collected about the asset is available on this page, including in Samoa, they have work requests relating to assets. So if there's a repair that needs doing, that'll be recorded in Tupaia as well. So you can also manage asset activity. So these are things like changes to locations or the assigned user, also the condition and status of an asset. So as change with an asset, that information can be recorded into Tupaia through surveys that can scan the QR code. So if you've got the asset in front of you, you scan the QR code, you can then change the condition or status or any other information. You can also record preventative maintenance activities, so repairs and decommissioning as well. So you can record that for each asset, and then you can view that information on dashboards, and it starts to build up a history of what has been done to each asset. Our users can also send what we call task requests to other users. So you could, if there's a fault on an asset, you could potentially send a request to the maintenance team or the asset manager from within a survey. So you'd create a survey for the asset to report a fault or something, or request a relocation. And that request would go straight to another user's email, whoever you'd nominated, and then they could respond to that request as well. And there's actually a dashboard for managing those requests and changing, responding to them as well. So what types of assets can be managed? So it's basically anything that you want to track, and also it's big enough to be labeled. So really tiny things, I don't know, you probably can't label them, but yeah, things that are big enough to have a label on them. So things like biomedical equipment, like patient monitors, vaccine fridges and x-ray machines, IT equipment, office furniture, kitchen appliances, vehicles. And also we have a module where you can actually register single items that get used only once. So things like spare parts for biomedical equipment and consumables, such as insecticide spray or printer cartridges. So where is Tupaia being used for asset management? So about, 6 countries now are using it to some extent. So Tonga was the first, and you hear from them later. Samoa's really using it very extensively now since sort of mid 2024. Fiji, Nauru, Palau, and PNG starting to use it in a pilot project for their biomedical equipment. So there are not many hardware requirements for the asset management system. So obviously we build the customized Tupaia, the software, but you do need a smartphone to be able to collect data and view data. A laptop is ideal if you want to look at the big asset register, the big tables. You can also view data through the smartphone, but sometimes the big tables get a bit tricky. A label printer, so it's important the label printer is portable and can print QR codes, and that the labels themselves are sturdy and laminated. So that's a label cartridge on the right that prints out sort of pre-laminated labels. You can stick to the assets. So yeah, I'll just talk you through what's going in Samoa in their absence. So the system was launched in June 2024. They've got a number of modules, a preventative maintenance module, including defib tests, as well as work requests, so repairs and relocations that are managed through Tupaia. And so far, they've registered 1,250 assets, 887 preventative maintenance activities have been recorded, 378 defib tests, and 224 work requests. So they're using it quite extensively. And we've got some dashboards to show you from their system as well. So this is sort of their main dashboard. There's a map of Samoa there with locations on it. The pins represent health facilities, and there's some information in those pins about what types of equipment and numbers are held at those locations. So that's showing oxygen concentrators and the number and type of or condition of oxygen concentrators at each facility. On the right-hand side is their sort of summary data, how many assets, the breakdown of the condition and status of assets, as well as when they've registered assets, that table, the graph down the bottom, they've registered a few in the last few months. So there's also, this is their preventative maintenance module. So they've got a form, that middle form is basically the IPM, the preventative maintenance form that they'll fill in, some questions about functional status and different components of equipment. It's quite an extensive form, actually. That's just a very small part of it. So they submit that form for an asset. So they fill this out for each asset they conduct preventative maintenance on. Then that data syncs into a big register on the top left-hand side there, which shows them all the information they've collected. And then there's also some summary data about how many they've conducted and when they were conducted, and that each one is a separate asset they've conducted preventive maintenance on. And this is what their DFib test dashboard and survey looks like. So every week they need to go around to all the DFibs in the major hospitals and check they're working. So the form on the top right-hand side says, the date when they did the test, what tests were conducted, is it all working okay? They submit that form for an individual DFib equipment. Then all that data then syncs into dashboards, a big table, as well as some summary information. So just in summary, so Tupaia can be used to manage a full asset register and can be updated by scanning an asset's QR code through your smartphone. Tupaia can also be used to record key activities associated with each asset. So maintenance and repair records are accessible within the reporting dashboards. And Tupaia can also be used to communicate and manage tasks relating to individual assets as well. And finally, I'd just like to say BES loves working with the awesome asset managers and biomed teams in the Pacific. So thank you very much.
Thanks so much, Geoff. That was awesome. And it's great to see all the work that's gone into our asset management module. Our next speaker today is Salele from Tonga. Salele is actually pre-recorded for us, which is awesome. There's a few cameos in there as well from her team. So Salele is the National Asset Management Manager for the Tonga Ministry of Health, and she's been at the Ministry of Health since 2010. Tonga was actually the first to use Tupaia for asset management and started in 2023. And Tonga uses Tupaia for their national asset register, allowing them to track all of their assets across the ministry. So I'll now get our IT team to hit play on that video for us.
Salele from the Kingdom of Tonga. My name is Salele Hola Oliveti. I'm currently the asset manager for the Ministry of Health, and it is an honor for me to present the Tupaia Asset Register System, supported by the Australian government and the Beyond Essential team from Australia. This is indeed a great achievement for the Ministry of Health in Tonga. As you can see, as I have started with the ministry in 2010, register of the assets were mainly done through using of the Excel spreadsheet, and reporting were done through Excel spreadsheet as well to the Ministry of Finance. So as years goes by, we identified the need to develop a proper system to be used by the Ministry of Health in order to register all the assets within the Ministry of Health, funded by the government recurrent fund, as well as any donation from our donor partners. So with register of the assets, we are complying with the Public Finance Management Act, Treasury Instruction 2020, there is a great need to make sure that all line ministry of the government take proper care and make sure all assets under the jurisdiction of the government are properly recorded and monitor its operation until we have come to a time for its disposal. As you can see, we have followed the Public Finance Management Act on a proper definition for fixed assets. So anything with a value of 500 Tonga MoH and above, we have to make sure that it is registered. Every asset more than 1 year of its lifetime has to be recorded as well. And assets which are purchased for long-term use and are not likely to be converted into cash quickly have to be asset as well. So with the types of assets that we had to record, all our physical assets from land, buildings, vehicles, biomedical equipment, computer hardware, computer software, furniture and fittings, office equipment, and other plants and equipment are taken into consideration. So with the Public Finance Management Act, all these types of assets have their own depreciation percentage. So during the lifetime of their assets, the depreciation percentage determines the lifetime for that asset until it is time to be properly disposed and be discarded as garbage. So while in 2022, we seek assistance from the Government of Australia through the DFID Fund for supporting us with the asset register system, and we were fortunate enough to receive from the Beyond Essential team. And I'd like to acknowledge Georgia, Geoff and Caroline for being the front line in designing the Tupaia asset register system for us here in Tonga. When we designed the asset register system, we wanted to make sure that we incorporate the maintenance part of the assets. During the design, we considered that the Tupaia asset management system will be the best application for us because we can incorporate the maintenance part into it. And during the consultation with the Beyond Essential team, into 2023, we have sent all the data for design of the system, and by October 2023, we started off with the training of the users with Geoff. So we would like to acknowledge Geoff for the great assistance here. So during the training, the team, we are given a proper training of the system, and we were managed to receive templates and printer label to assist with asset registering of assets here at the Ministry of Health. So to talk about the benefit of this asset register, the using of the asset register system through Tupaia allow us to keep track of our assets within the Ministry of Health. So what I mean by every asset is every asset funded by the government fund, and also through donation by the government of Australia or New Zealand, or any in-kind donation. So we were managed to make sure that every asset is accounted for. With registering of these assets, it enables organization staff to make sure that they account for all assets. And we also make sure that fair value of assets is in place while using the system. And the system as well enable us to make sure that preventative maintenance program is in place and conducted according to plan. One of the benefits of this system also is the prolonged value of assets and facilities, because we are now able to make sure the preventative maintenance program is in place from the system. Cost effective, and this allows us to make sure that the budget is utilized wisely while using of the system. So another benefit is we ensure that healthcare services is effectively done and allow us to properly monitor the status of each asset, especially from donor, and accuracy of report when we do the reporting. While using the system, we have identified some issues, and some of the issues that we have identified including the loss of assets. So loss of assets, some of the staff claim that they own or claim ownership of these assets, and they manage to claim that it is theirs instead of the government and Ministry of Health assets. Loss of assets were stolen. So some of the issues that we identified, that assets are lost and are not properly accounted for it is being stolen within the ministry. So misuse of assets by staff, non-compliance with the process, procurement process, as well as when it comes to construction and renovations of building facilities. And also we have identified the issue of non-compliance with the disposal process. So with these issues, it really affects the service delivery with no required asset in place and non-compliance with the process. And as you can see, it directly hits the service delivery. Therefore, it affects the patient care from the Ministry of Health. So we have identified way forward for using of this asset register system. So it is an opportunity for us to make sure that we raise awareness to our staff on our proper policies in place, that we have a good system, that we register everything whenever an asset is in the ministry, and also to raise the awareness of the process. It allows us as the ministry to be accountable and be responsible for all the assets within the ministry, and we are in compliance with the Public Finance Management Act and the Public Service Commission policy, as well as the practice of service of care delivered from the Ministry of Health. So with the asset register system, our co-workers will demonstrate the use of the assets from their own template.
My name is Tohiro Katsuki, and I work as a biomedical advisor, technical advisor for the Ministry of Health in Tonga. My role in the ministry is to assist in the day-to-day operation of the biomedical engineering department, including capacity building and technical development for our team. And today I want to talk on the importance of Tupaia inventory software with the biomedical engineering in Tonga. Previously we've been using a spreadsheet throughout, and it's a great thing we have the Tupaia inventory software. We have migrated away from the Excel spreadsheet that we used to use before. So in Tonga, one of the key benefits of the Tupaia network is improved efficiency, which is automated tasks like tracking, stock level, ordering, and reduce manual errors and saves time for healthcare professionals. That is one of the key benefits. The second one will be enhanced accuracy, provide real-time visibility of the equipment at the different locations. So we are able to locate, scan, and identify the location of these equipment wherever in the hospital in Tonga. Regulatory compliance, track the entire life cycle of the medical equipment. We can know when to replace a particular type of equipment. That is one of the other benefits that I can say that we are grateful for this Tupaia software. Predictive maintenance, we are able to program and update our maintenance of the medical equipment through our preventative maintenance program, which we do it every year. And the last one will be better asset management, creating individual profile for each piece of medical equipment and tracking them, have a proper record of the maintenance history as well. How do we how asset registration happens in the biomedical engineering department? When we receive a new piece of equipment, there are certain tests we usually do. These include electrical safety testing and also acceptance test. This is a must that we need to do. So we do this to make sure that the equipments are working to standard, in accordance with the medical equipment standard. And after we go through this process, then we have to go to the asset registry, which is asset tagging. That's when we have to record the equipment and also have them recorded in our inventory system. That is the asset tagging and real monitoring. When we go back and do a preventative maintenance, this software helps us to identify the location of the equipment and importance of the main important things about Tupaia, which I can say is tracking the medical equipment in the different locations, and also have a real-time update of what is going on with the particular medical equipment. Thank you. So this is how we use the Tupaia software to register a new piece of equipment that we receive in the hospital. So when we receive a new piece of equipment, we do an acceptance test or an electrical safety to make sure that the this piece of medical equipment meet the medical equipment standard, which is safe for us to use in the hospital. So the first thing we do is do an acceptance and prevent. We do an electrical safety test. So we connect the medical equipment to electrical safety tester, and then that runs through the process of testing on the electrical compliance of the medical equipment. Once that is completed, everything is passed. Then we go to the next phase, which is asset tagging and asset registration. And that's when we use our Tupaia software to enter all the information about the particular equipment. And after we enter everything into the system, we print out the barcode reader that we use to tag every individual equipment. So this is the asset tagging that we have for this particular defibrillator. Thank you.
Malo Apito.
Thanks so much, Salele and your team, for putting together that video. We're actually lucky enough to also have Salele on the call with us today. So if anyone has any questions, and similar for Geoff or any of our other presenters, feel free to put them in the chat and we can answer them in the chat, or if we get time, come back to those at the end. We're going to move on now to our next presentation, which is going to be from Whitney in Palau. So Whitney is the e-health coordinator at the Palau Ministry of Health and Human Services. Led by Whitney, the asset management project went live in early 2025, I believe, and is predominantly being used for tracking vehicles owned by Ministry of Health and Human Services. So it's been really interesting to see all the different use cases for it. So I'm going to hand over to Whitney, who is going to share their screen, I believe, and give us a bit of a live demo of how it's being used. Over to yourself, Whitney.
Hi, good morning, good afternoon, and probably in a rare case, good evening to most of you. So today I'll be presenting another portion of asset management in Tupaia with a focus on how we transform the way we manage our vehicles. So in the past, our process relied heavily on logbooks and paper forms to track mileage, fuel consumption, and trips within the offices. So while this method worked for record keeping, it posed significant challenges, especially when it came to analyzing and aggregating the data. In a month, we'll probably have like 3 logbooks or 4 logbooks to manage, vehicles, and we had to manually transfer that information into Excel, clean it up, and then use pivot tables to create dashboards, and it was really time consuming. And it was error prone. With Tupaia, we've been able to streamline this workflow by building surveys, visuals, and dashboards directly into the platform. And we have now real-time insights into vehicle consumptions, costs, and maintenance. And the shift was not only improved accuracy, but it also made decisions making more efficiently and data-driven, and it was a really big plus because now we don't have to convert anything into pivot tables, and all we have to do is just click on dashboards and visuals and make decisions right there and there. And so unfortunately, I didn't do a video or a PowerPoint presentation because I wanted to show you guys in real time. And so I'm just going to go ahead and share my screen. Can you guys see my screen?
Yes, we can see. We can see both DataTrack and Tupaia.
Okay, great. And so in the office we use DataTrack, for editing any surveys that were that we made a mistake. But most of the time we use the Tupaia MediTrack app, and it's quick on the go, very convenient, and so the users, it's easy for them to use the app because they're always on the go. So one thing I want to point out about this project is, one, We wanted to make it efficient, uh, less touching on the phone, and very quick. Report what you need to do, report, and then go. And so as you can see, we built 4 surveys. So hospital vehicles. So we built 4 surveys. So surveys are vehicle registration form, and so every time there's a new vehicle, we register that vehicle. And so if you can see on the survey, we register a vehicle. We use hierarchies as well. I mean, what do you call this? We register it to a certain facility, and so that way we can track it per department and per facilities. And so we register it, and so a lot of our surveys was reflective on the registration, and it was very important that we did that because a lot of our visuals come off from the registration and surveys that we used to check out. And so as you can see here, we use a vehicle make, model year, vehicle color, VIN number, registration, plate number, and beginning mileage and miles per gallon. And we use those to calculate it on the dashboard, so that way we don't have to manually calculate it. All right, let me go back. The next survey that we use is the checkout form. HAO4 vehicle check-in. And so what this does is that they check in, so that way we can pull up the time. And so we can actually track vehicles when they check in and when they return it. And so we can get an average time of how long is the trip duration. And then when you check in, you do everything that you need to do. When you return, you would come to the vehicle checkout form. And in this form, it's a little bit lengthy, so not as lengthy as we thought. And so you would click the facility, and then you have the option so on the keychain of each vehicle, there's a QR code. So you can scan the QR code of the vehicle, or you can select it, whichever works for you. You would go next, select your department. And because we have so much employees, we decided not to use the user accounts as the driver's name, and so we just loaded all the employees' name, and so you can just type it in, and there's a reason for this. And then you would enter your odometer mileage after your trip. So let's say 1, 2, 3, 4, 5, 6. You would gauge your fuel level. So this was a little bit tricky because what we really wanted to do with this is we wanted to make sure that the administrative officers who manage these vehicles will be able to see in real time what's the fuel level, so they can send out an order to do a refuel, versus going to each vehicle at the end of the day, checking the fuel volume, and then going to get an approval. And so what we did is we converted this on a visual, and so full is 100%, below full is 75%, 97.5% if I'm not mistaken. 3/4 full is 75%. Below 3/4 is 62.5%, and then half is obviously 50%, and then below half is 38.5, and then 1/4 25, and then below 1/4 is 12.5. And so what the administrative people do is they will take a look at that visual and say, okay, it is at 12.5%. We need to fuel this vehicle. There's recorded trips that's been saved for the next couple of days, so we need to go fuel this vehicle because it's not going to be allowable. And so let's just go ahead and click one of those. Interior cleanliness. So we did this so that way we can track who's a really messy employee and who are the ones who are not cleaning after themselves when they use the vehicle. And so cleanliness on these vehicles has gotten so much better because no one wants to get that conversation like, okay, you need to bring the car to the car wash after your use. And then reason for trips. And so we aggregated reasons for trips so that we can have an idea on what are the vehicles really used for. And so what we did is we went through our logbooks and we aggregated all our logbooks and we pulled into all these options. And so most of our trips are delivery and pickup, financial payroll submissions, HR personnel submissions, meeting conferences, on-call trips, outreach, personal, and then personal is because we have people who use who are assigned a government vehicle. And so we use that personal to be able to calculate the fuel that we are not going to pay out. We're just going to use that to subtract on the total fuel. And so that way we know we're not going to pay that out. And then renting, borrowing, because we have other departments that uses our vehicles. And so that's what renting and borrowing is for. And then obviously supply requisitions, vehicle fueling and maintenance. So we are just gonna go to delivery and pickup because that is our top two. And then we aggregated all the data and we noticed that each trip averages no more than 6 trips. And so what we did is we did 7 options where people where we aggregate all the data and we listed all the trips within here. So people can just come here. And so what it does, it tracks where your movement is. And then I'll show you that when we go to the visual. So we can just go, this is a supply store. All right. And then as you can see, review and submit. We will go ahead and submit that. And that's it. And so when you come into this side, when you come into your dashboard, and so the dashboard, we created a vehicle trip. So we created a couple of dashboards. So this is basically the administrative dashboard. And so the people in the administration office can view this. So this is tracked by vehicle number, the driver, the department, the trip reason, and all the stops that they made. And so what this does is tells us, okay, so you went to Palau National Hospital, and this is an on-call trip, so meaning this person was at home and went to Palau National Hospital, and he used 13 miles, and the trip calculation was $3.07. And so we, the administrative office, what they do is they audit this, and then they go through, okay, I don't think it takes 98 miles for an on-call trip from your house to Palau National Hospital. 98 miles is already outside in the ocean, so everyone will go through it and will be like, okay, that don't look right. And so what the administration does is they go to that person and say, hey, I was looking at your trip, it doesn't look real. Can you validate it? All right. And then that cost, so that cost is associated with the fuel pricing here. And so if the fluctuation goes up, the fluctuation goes down, we enter that into this survey, which is vehicle update. And vehicle update updates the price per gallon for the fuel, and it also updates the registration. And so I'm going to pull you up to this dashboard. And so this dashboard is a dashboard for individual vehicles. So as you can see, this vehicle 1723 administration office, if you're on this Zoom call, just letting you know your vehicle is expired. It's already past August 28th. And so whatever you update on the vehicle vehicle update will reflect these dashboard. So like we were talking about department usage, and so as you can see, vehicle 1723, the highest consumption department is administration office, which is the hospital administration office. We can also see by in department usage as a matrix table. So if you don't want to see the graphs, you can see the vehicle expiration date. You can also see the vehicle fuel level. And so this is what we were talking about on full, half full. And then vehicle trip. So we can see that this vehicle is very popular in going to the vice president's office, one stop shop. And so this visual also helps us, with maintenance and see like, okay, which vehicle do we need to service because it has too many trips, many people use it. And then we also have the vehicle trips as a matrix table as well. And we've been using this part of the asset management for about 3 months. And the first 2 months was a pilot test. And I'm telling you, it was tough, people and technology, we get a lot of pushbacks. We did have a lot of errors, so there were times our numbers would be negative on the mileage, and that was just human error. And what we did to improve that is we had a series of one-on-one trainings to ensure for each department to make sure that everyone is using it correctly. We do some weekly check-ins to make sure that everyone understands what's going on. And we've actually improved a lot. We are also still building more visuals, so other visuals that we want to build to better it to our capacities to be able to build that cost to it, to aggregate the cost, so that way we know what consumption of fuel we're using per month, so we don't go over our purchase order with the government. And so one thing about Tupaia that I learned was the sky's the limit. And so it took about 6 months of brainstorming to get to it. And I had some inspiration from Geoff when he first launched asset management. And I was like, okay, maybe we can tweak this a little bit. And it took us like 6 months to build it. A lot of back and forth, but we got it up and we did the pilot testing, and here we are now. And yeah, that was it on my end, Georgia. Open for questions.
Thanks so much, Whitney. That was a fantastic presentation. It's really interesting to see the different ways that Tupaia is being used for asset management. I'm probably biased, but I totally agree that with Tupaia, the sky's the limit. There's so many different ways that it gets used. I'm going to move along to our next presenter, just in the interest of time. So our next presenter is Tulia from Fiji. So Tulia is the Senior Assistant Health Inspector, but is currently acting as the Health Inspector or Officer in Charge for the National Vector Control Unit at the Ministry of Health and Medical Services in Fiji. The National Vector Control Unit is using Tupaia to manage its vector surveillance equipment and insecticides. So I'll hand over to yourself, Tulia, to present for us today.
Okay, thank you, Bulavinaka from Fiji. This morning I'll be presenting on the Tupaia asset management system, the one that we're currently using in Fiji. Before I present, I would like to thank the Tupaia team for helping us in this app. So can we go to the next slide, please? So in Fiji, the data system that we actually currently using is we only manage by the Excel spreadsheet, and that's from 2016 till to date. The record and everything is done on paper, then we transfer to the Excel. So we have something like our stock record sheet. That's all through all our surveillance data and presence of larvae, adult trapping, all those things is captured on Excel before we introduced the Tupaia app. So our current system was from 2016. We were using the spreadsheet alone, the Excel spreadsheet. So with those spreadsheet, our reporting is inconsistent. Most of our stock records we missed out, and also our reporting and timely to our respective health officers were delayed because of this data management system, the current, the old one that we were using. So with the advantage of our Tupaia, okay, the advantage of that, it's managed by the national level, but the disadvantages, it was more of time consuming for us entering the data and the Excel spreadsheet. See the accountability and safekeeping of our assets. It's not well maintained by our respective health office and even in our national office. So the paper management system was not well maintained, as if there was a missing piece of paper, we couldn't find all those records. So the high chance of stock management and assets are lost. So it needs so while we're accessing that, it needs to be connected to a server for accessibility, and it's the storage space on our database, it's limited, so we don't have that enough storage or space. So with the introduction of this Tupaia asset management app, the National Vector Control Unit were able to keep records of all our registered items on the database. We were able to record and see in real-time data on our database the actual assets that we have. So right now we're still doing our recording. We're still registering our assets. So we have a lot of assets that we still need to register, and we still need to go down to our respective division to also register our existing assets, vector management assets. So more than 60 assets we have been registering at national office, and 1,400 consumables. While we introduced to this app, we've seen that it saves a lot of time from us entering all our assets on stock Excel sheets. And we have real-time data captured on the dashboard. So everything is just captured there. For our reporting, we just have to click on that and present our data. So everything is user-friendly. So all the records of assets we received or loan assets by our respective health office, we have records on the dashboard, or any maintenance that needs to be carried out for our machines and other assets that we have. So with this Tupaia system, it also provides a sense of accountability to our health officers in taking care of our assets. So that's one great advantage to us with the introduction of this Tupaia. Everything is captured on the data with real-time graph shown on the dashboard. So as well as the safekeeping of our assets on the records, compared to the older system, if the paper is missing or we forget to enter in the database, it's not there. So with this Tupaia system, everything is captured. So the data is always available. If we don't have it's connected to a server or not, even without connecting to a server, we can still do our registration and everything. So once we sync, then everything is captured there. So also with the unique, we have a unique pass and account for this Tupaia system, which is a great advantage. And all syncing can be done afterwards when connected to a server, especially when we are doing our example for when we go out for our surveillance. Most of the area that we go to, the geographical location, we don't have the internet connection. So we can just do it on MediTrack, and after we have a connection, then we can just sync our data, which is a great advantage to us. So with the Tupaia asset management app features, it's mostly user-friendly features. It keeps track of all the assets that are coming into our office, the one that we newly purchased, the one that is going out to the respective divisions, and the change of status of vector assets. If one division, example, if the national vector have changed this, our machines have been delivered to another health office, so we can know if something is wrong from that asset within that health office, they are responsible for that damages. So which is a great advantage to us, because most of our from before, so always the national office takes the blame if there's something is wrong with our machines or any assets that we have. So it picks up default and maintenance features and recording and distribution and storage of our assets. So every asset that we have, it has a unique coding, and we thank the Tupaia app and the BES for providing us with our coding machines, which we have been using. So with advanced features, we are able to provide a sense of accountability, as mentioned by our respective health office. So that's the great advantage, and the system are more advanced, and we are gradually shifting from paper management to Tupaia app and to the more digitalized system. So maybe some of the improvements of we're just noting maybe some of the accessibility of the Tupaia account to some of our vector surveillance officer in our respective division, if they can have also be accessible to this. And the Tupaia system, maybe we should adopt in Fiji, the system updated due to staff movements, and the training is it's part of our business plan now that we have to train our respective health office staff, our health inspector in the field, to be more knowledgeable on the system, on the Tupaia app system, because they need to be trained. If one staff that has been trained and that staff moves, the knowledge moves with them. The accuracy of information and given for a few our abbreviations of our key. So maybe some of the key that we use, we have to have something like sort of a unique abbreviation for all our health office. And with this, it's more reliable and resourceful. It's user-friendly. The more consistent, our report is more consistent now we compared to before. Like we've been acknowledged that our reporting is now been consistent to our respective, even with not on asset, with our surveillance. We have a Tupaia app on surveillance as well, and training to be provided if there's a new features on the system improved. Thank you. And we need to acknowledge our staff and the Tupaia team, and also our BES for the funding and helping us establishing this Tupaia system. Thank you.
Thanks so much, Tulia, for your presentation, and it was great to hear about how the National Vector team are using Tupaia for their asset management. We've come to the end now of all of our presenters. It's been really great to see the variety of ways that the tool is being used. I just want to let everyone know as well that this is being recorded, so it will be up on our YouTube page if you want to catch up on it. And I'd also like to thank DFAT's Global Health Division under the PHR who support our PHR, our Pacific Digital Health webinar series. So thank you everyone for joining today, and we will see you all in a month in October. Thank you so much.